Okay, so it's 16 minutes past, so we're going to kick off. Thank you again for joining us for our NHS Careers Fair. I'm joined by some wonderful mental health practitioners who are here to share their experience, their career pathways, their skills, their knowledge, and really answer your questions about potentially becoming a mental health practitioner. So if you do have any questions, we have got a Q&A function at the bottom. You can type them in. What we're going to do is we're going to ask some questions at the beginning, and then at the end we will ask your questions and you'll be able to get some personalised advice, feedback, answers that you've been looking for from our experts here. So don't forget to pop those questions in throughout the presentation. So we're going to kick off by getting our experts to introduce themselves. My name is Rosie, by the way. I don't think I did say that. I work for Middlesex University in the Education Liaison Outreach team. Part of my job is to go into schools and colleges and chat to people about potential careers, higher education, all those kind of things. So it's great to be here today to be able to support you. So I'm just going to go around on my screen and ask you guys to give an introduction. So who am I going to pick on first? I think Faye, you're in my top left corner. If you don't mind unmuting and introducing yourself. Thank you.
Okay, so if I can introduce myself, my name is Faye Heatley, and I'm working as a counsellor. To be fair, I'm just coming to the end of a very long training. So the training for a counsellor can be 5 years, and it's taken me 7 years. So be prepared to do you know, a long training for something if you're going to go into that line of work. We've just been asked to talk very briefly about what we do. So I have a caseload. I work with individuals sort of 50 minutes at a time, and I have 2 small caseloads, and one is long-term. So I have relationships with people for sort of 2 and 3 years at the moment who want to make changes, and you engage in a long-term relationship to help them make changes and I think live a different life, live differently than they're able to live up until what brought them to counselling. I also do shorter term work, so I work with Mind in Barnet, and that's bereavement work, and that's much shorter, and that's 12 sessions. So I would say in the work, be prepared to learn as much about yourself as other people. It can be very exposing, and I've come to it sort of later in life. I think you do need to be prepared to open yourself up to some difficult feelings, and people do have a lot of loss and trauma and live very difficult lives. And you need to be curious about other people, which sounds like a bit of a cliche, but if you're not curious, then I don't think it's sustainable. You need some good people around you as well. So while you work on your own with clients, you must work in a team. You must be supported. You must have good colleagues. You must have good supervision. So just because you're working with a person one-to-one, you need a really good network of support around you to help you to sustain the difficulties that you're dealing with other people's lives. And I think you need to be realistic about these times, be prepared to work in the gig economy. I think my colleagues and my peers here perhaps work for the NHS, and that's a very different career. And if you work as a counsellor, you can end up you know, needing to set up your own business as well. So people go and work in private practice. So there's a lot of different skills. There's a lot of different ranges of jobs. There's a bit of a cliche, but there's a portfolio career that people have. So they do different types of work and different bits and pieces and patch their jobs together. So it can be a very interesting life, but you need a lot of different skills, and it takes a time to build.
Some fantastic lessons there. Thank you so much, Faye. That was wonderful. Tanya, I believe you are next on my screen. Thank you.
Thanks, Rosie. Hi, I'm Tanya, and I am the Allied Health Professions Lead for Barnet Enfield and Haringey Trust, but I am an occupational therapist by profession. So very briefly, I qualified as an occupational therapist. Why did I go into occupational therapy? I don't know. I appreciate that's not helpful to those of you who are watching. But I absolutely agree with Faye that I learned very early on that it's important to be curious about people. If you're not curious about people, if you're not interested in people, if you don't really want to listen to people, then maybe you need to think of a different route. But for me, the curiosity about people and people's lives has kept me in my profession for a very long time. I graduated and worked as an occupational therapist in mental health as soon as I graduated, because that was the area of work I most enjoyed. That doesn't mean that I can't work on a general ward. It's just that I prefer and always have preferred to work in mental health. As a career, though, there are so many routes that you are able to go down once you do graduate as an occupational therapist, or indeed in any allied health profession. Now, way more opportunity than there were when I graduated. I went from working as a newly qualified occupational therapist and then on to managing inpatient mental health wards. From there, I went into voluntary sector, because don't imagine that people in mental health are just working for the NHS. There are other organisations, other sectors that we can work in, including charities and other voluntary sector organisations that really value the skills that we can offer. And certainly that is a growing industry around mental health, is what the voluntary sector can offer. And then from voluntary sector, I came back into the NHS, back to Barnet, Enfield and Haringey, where I am now the Allied Health Professions Lead, which means that I pull together all the allied health professions across the trust. There are 8 in our trust. There are 14 altogether. So as a very quick, if I can list them all really quickly, the 8 that we have at Barnet, Enfield and Haringey are physiotherapy, occupational therapy, speech and language therapy, podiatry, music therapy, art therapy, drama therapy and dietetics. I hope that came to 8.
Yeah, that's very impressive.
8 of the 14. And so my job at Barnet, Enfield and Haringey is to bring all those people together, because we are the 3rd largest combined. We are the 3rd largest workforce in the NHS. And we have a lot to say for ourselves, but sometimes we don't say it loudly enough. And if we want to be able to provide 21st century care, then we need to come together to do that.
Yeah, no, absolutely. And we've already had a question. We'll save it till the end, but just so you can think about it. What is a typical day like as an occupational therapist? So you mull on that one, because that's a big question. But we're getting some good questions in already. So right, I will go to Deborah. Deborah, please. Oh, you're on mute, my friend. It was going to happen once.
Very typical. Nice to meet you all, although I wish it were in person. I'm Deborah. I'm a child and adolescent psychiatrist at the same trust as Tanya and a few people here. And I'm also something called Deputy Medical Director for the trust. I'm not going to talk to you about that role very much, because I think it's probably more interesting for you to hear about being a child and adolescent psychiatrist. I've got a little bit of a blurb that I wrote on Tuesday, thinking about the next day. I'll just read it out. Tomorrow's Wednesday. I'll start the morning supervising a psychologist with her project to improve the care for young people coming into A&E in a crisis. After that, I'm off to join a huddle with other doctors, therapists and nurses discussing the kids who've come onto the ward overnight and who might need to be assessed, seen or supported during that day. From there on, I head over to the ward with my liaison nurse, picking up a coffee on my way, of course, to review a kid, an 8-year-old, who's come in with a lot of unexplained symptoms, including tingling, numbness, difficulty with her eyesight. I chat to her nurse, read the notes, check what tests she's had and meet with her, both on her own and with her family. The medics can't explain why she's got these symptoms. They don't match up with any of those illnesses that they know about. When I'm meeting her, I'm trying to get into her shoes and see the world from her perspective. I've always got a set of coloured pens and paper at the ready, so I can play games with her and find out more without asking too many of those difficult questions. Next, I'm off to the team meeting. I'll look at all the referrals from GPs to our CAMS, our child psychiatry services, and decide who's the best person to see them and whether they should be seen by us or someone else. After that, I'm meeting with the paediatricians to discuss all the kids on the ward and anyone that needs extra help. I'm doing a flow chart with another young person who's been through our services, and she's helping us to see where we could do things better. At 3:30, I'm off to see another young person. This time it's a 17-year-old who's come in with a severe panic attack and is really agitated and feeling quite low. I decide with the team what they need overnight. Do they need a timetable on the ward so that they can keep distracted from how they're feeling? Do they need some support or a psychologist helping them to manage their panic? And do we need to think about medication just in case they get really unwell overnight, although this is always a last resort? The day ends with a brief teaching session with the trainees on how to support young people having problems with eating and drinking, and then it's time to go home. So just to add a few details about my job before I pass back to Rosie. So as you'll have heard from that description, I'm somebody who assesses and treats young people with mental health difficulties within a hospital setting. But actually child psychiatrists work in loads of different settings, and child psychiatrists work in community clinics, they work all over the place, and in specialist inpatient units for adolescents with difficulties. But there are other types of psychiatrists. There are people who work with adults, with older people, who work in prison settings, or who work with people with addictions or eating disorders. I could say more, but I think you're in a hurry. We can talk about the training later if you prefer.
That's fantastic. Thank you, Deborah. That's a really enlightening sort of day. Describing your job hour by hour is brilliant. Thank you. And we're getting loads of questions that come in that are fantastic. Some of them are actually, all of them are better than the ones that I've written down. So we might go straight to what people are asking after we've done instructions. Thank you, Deborah. Reka, I believe you're next on my screen.
Hello, everyone. Good afternoon. My name's Reka. I've got many roles and many hats because I've been a nurse for that long. So that's what usually happens. But what I'd like to talk to you about today is my 23-year experience as a mental health nurse working in forensics specialist services. So at BEH, we were the first forensics unit in the country to be given a CQC Excellent, and we've retained that and we've expanded on that. And what does forensics mean? So forensic psychiatry is about the treatment of the mentally disordered offender. So I work with people who have come through the criminal justice system who are mentally ill. So people who've got offences that range from murder, rape, arson, paedophilia, aggravated assault, armed robbery. And we do a variety of things within specialist services, not just working with mentally disordered offenders. We work with child and adolescent services. We have an eating disorders unit. We have the prison services. We have learning disability services too. So that gives you the span of the specialist services. And there are many, many, many interventions that you can do as a mental health nurse. So we're involved with everything from assessing to counselling to providing activities to working with a range of professionals. So we can work with families and carers, obviously, but we also work with other professionals. We work with the criminal justice system. We have liaison with courts and the police stations, British Transport Police, and also FTAC, their Fixed Threat Assessment Centre, working with stalkers. So it's a really diverse area, specialist mental health nursing, and it'd be lovely if you wanted to find out more about it.
Fantastic. Thank you so much, Reka. We've already had a couple of questions specific to that coming in, so we'll be asking you in a second. And then Suchi, I believe you are last, but definitely not least.
Very kind. Thank you, Rosie. So hi, everybody. I'm Suchi Bhandari. Call me Suchi. My professional background is that I'm a consultant clinical psychologist, and my job role currently is that I am Barnett Enfield Haringey's Trust Head of Psychological Therapies. So I've had a long career in, I won't tell you the number of years, but I've had a long career in mental health and in clinical psychology in the NHS. And So how I have got here is really by doing, as I think even Faye and others have said, it's a long training, so be prepared for a long training. So I've done my graduation and master's in psychology. I went on to do a PhD. Our clinical psychology training is a doctorate, 3 years doctorate program, but one has to have a lot of assistant psychology and other types of experience before one can apply. But I'm very happy to talk through that. So in terms of the pathways, there are lots of psychological therapy kind of pathways around. So you can be a counseling psychologist, you can be a clinical psychologist, you can be a psychotherapist, and each of these, the registrations and the regulatory bodies are different. Now there's a new program for apprenticeships which has started, which is the clinical associate practitioners. There is a route into psychological therapy through IAPT program. So it's the improving access to psychological therapies, where you can train as a PWP worker or a high intensity. So there are several pathways. Now, my kind of area of expertise is an adult. So I'm an adult clinical psychologist, but more recently, with a lot of sort of years gone in, I do a lot of management. I do strategy for psychological therapies in terms of how services should develop across the trust. I deal with a lot of professional issues. So our regulatory bodies could be things like UKCP, Healthcare Professions Council, which is also AHP's regulatory body. There are other regulatory bodies like BACP. So a whole host of sort of different management and strategic kind of level areas that I work with now, given that I've gone up the ladder and I'm in a senior post. But just to also say, if you're a clinician, you work in several pathways, and you can work, as Deborah and others have talked about, you can work in child and adolescent mental health as a clinical psychologist or psychological therapist, in learning disabilities, in adults, in older adults, in forensics, eating disorders. So there are several pathways as working with clients and service users, because I think Tanya and others have talked about human interest and the kind of interpersonal aspects and the relational aspects to therapeutic relationships in terms of bringing about change in clients. We work with a lot of trauma, adverse childhood experiences in not just in children, but all the way through. We work with lots of mental health presentations like depression, anxiety, personality disorder, severe mental illness. I could go on, but I'll keep quiet there because I was only allowed a minute. But do send your questions.
Yes, definitely. I can't stop when you're talking, and it's so interesting. So thank you so much for all of those introductions. I hope everyone who's listening has got a really good idea of who you are. Oh, Anna, you popped back on my screen. You're back. I don't know what happened to you, but hello. So we've got one more. Anna, if you could keep it to a minute, I'm really sorry, because we have run over already, and I definitely want to get stuck into these questions that are being asked. So go for it. If you could unmute and introduce, that'd be fantastic. Can you unmute, Anna?
Hi everyone, hi. My name's Anna Spiteri, and I'm actually a physiotherapist in the trust. So when I was 17, I did some work experience at Barnet General Hospital, as it was then. And then after my A-levels, I went into physiotherapy. And I worked at Barnet for 3 years as a general physiotherapist. And then after 3 years, I went to work in Barnet, what is now Barnet, Enfield and Haringey Trust, Mental Health Trust, as a physiotherapist, working in with children's services. So working in physical health, not mental health, in children's services. So I did that for a number of years, and I really love the diversity of it, working in the hospital, working in clinics, working in schools, working in people's homes, all of that sort of thing. And then about 4 years ago, I took a role as a Freedom to Speak Up guardian. So that really took me into working just one day a week across the wider trust. And I really, really enjoyed working with my mental health colleagues. And then just in the last 5 months, I've actually taken a full-time role as a quality improvement coach. And the wonderful thing is that it gets me to working with all of my fantastic colleagues, and it's been fantastic hearing about all the different roles that my colleagues have in the organisation. But as a quality improvement coach, I get to work with all of them. So today, the day started off working with in Enfield, looking at pathways for autism and looking at pathways for ADHD, how we can improve those pathways. And then in the afternoon, it was up to one of the mental health wards at Edgware Community Hospital, and working with the occupational therapists and working with the nurses and working with the service users themselves, talking with them about what we're going to do to improve what we can do to really improve the pathway for our colleagues that are the service users that are actually on the inpatient ward. So there's a huge diversity. So my role as a physiotherapist is sort of on the back foot at the moment, and I'm actually doing this quality improvement role. So there's a huge amount of scope when you come into the health service to actually translate the skills that you've learned into other roles as well. So just because you start off as one thing doesn't necessarily mean that you're going to finish off as that. So that's what I'm.
That's fantastic. Thank you so much, Anna. No, that's great. Thank you. Brilliant. Thank you, everyone. So I'm going to launch into the questions that are being asked lots already. Thank you very much, Deborah. I can see you're already answering some, so that's wonderful. Actually, so the first one we've got is, what's the best thing and worst thing about your jobs? And I think that's a really nice one to start off with, because it gives you an idea, it will give them an idea of what you really find rewarding, what you find challenging. I think, Deborah, you said you'd like to answer this question live, so I'll kick off with you first, and we'll spend a couple of minutes discussing this one.
Thank you. Although actually I didn't understand the technology and accidentally said I'd want to answer it, so I haven't given it any thought. But I suppose the best thing about my job, I would say, is that it's an incredible honour to be allowed into someone's life, especially at their most vulnerable, and to really come alongside them and see change and improvement. And it's immensely rewarding. I can't think of anything more rewarding, really, and very personal. And the worst thing, well, the worst thing in my training was having to do sort of night shifts and long hours as a junior doctor, but that's much better now. And the worst thing I would say now is to be realistic about some of the things you can't make a difference about. So realistically, I can't improve the the housing situation of some of my young people who are struggling with that, or the poverty they're living in. It's heartbreaking to see some of the things that you can't do anything about. But once you realise that actually that's not your gift, you can't do that, you then focus on what you can make a difference. And often you can be an advocate for those things as well.
Yep. No, I think those are very, very good good answers. Thank you, Deborah. Faye, I saw you nodding along. I don't know if there's anything else you wanted to add to the rewards and challenges of your career.
I was nodding away, but I think it's Deborah's a psychiatrist, isn't it? And so I think it's very similar. It's the relationships with people that you're allowed into, the intimacy of the relationship that you have, which is really one of such trust, and that's very rewarding and very moving. So that's very powerful. But also, I think I would just echo what Deborah said, that if you work with very vulnerable clients, living with such difficulties, such scales of trauma, such poverty, and also clients on the borderline, where even after long amounts of work, it can be very enigmatic, that you can't make everyone better, you can't make it all okay. It's still a very deep and very moving experience, but it's being realistic about how much people can change as well. They can, but we can't change everything. So being realistic about it as well.
That's brilliant. Thank you, Faye. Got another interesting one that's just come in. Can you explain a little about what it's like to work as a physiotherapist and what it involves? Who would like to take that one? Is Anna? I feel like Anna's trying to unmute. She's ready to talk.
Yeah, ready to talk. Well, physiotherapy is a little bit like what Deborah described psychiatry being lots and lots of different fields, and it's exactly the same with physiotherapy. So you can work in pediatrics with children 0 to 19s, you can work with older people, you can work in sports clinics, you can work in outpatient clinics, you can work post-orthopedically, you can work with respiratory patients. We've seen a huge amount of diversity in the skills that a physiotherapist would bring during COVID, because actually there's been a real focus on the respiratory physiotherapy in intensive care units and post-COVID as well. So huge amount of diversity there. So usually after you qualify as a physiotherapist, you will go into a general hospital and do rotations in all of the different fields. And then you get a feel for which perhaps area that you want to specialize in. And I very, very much like the diversity. And so actually in pediatrics with 0 to 19, you're working across the whole field. You're working with respiratory patients, orthopedic patients, with neurodisability patients, with patients post perhaps a brain tumor, post accident, all of that sort of thing, and just normal other patients that get knee pain, back pain, neck pain, elbow pain, all of that sort of thing as well. So I really like the diversity of that. And so I worked in pediatrics for a number of years. But actually, since last November, I've actually come out. I'm working full-time in the quality improvement team. Again, it's a huge diversity because you're working with all the teams across the whole organisation, and including the physiotherapist, including the occupational therapist, and including all of my colleagues here. Diversity.
Brilliant. Thank you so much, Anna. Sorry, I was struggling to unmute there. Brilliant. Would anyone like to add to that one? If not, I can move on because we've got plenty of questions coming in. All right, I shall move on. Okie doke. So one we were discussing very briefly just before we started, which was, bear with me a second. At the end of the day, can you switch off your thoughts, or do you bring them with you at home? I think this must be hard to separate work from private life. Who would like to take that one? Tanya?
Oh, then I will. Yeah.
Go for it, Tanya.
So yes, I think is the answer. It is difficult to switch off. We would be human if it wasn't. But the skill is to surround yourselves with the support systems that enable you to leave some of this stuff at the doorstep as you leave in the evening and pick it up again when you come in the morning. So using the support systems that we have within the workplace, whether it's other colleagues, whether it's supervision, whether it's peer-to-peer, whether it's just, well, once upon a time it used to be grabbing a coffee with somebody. Now that's not quite so easy, but those interactions with other people throughout the day help you to synthesize what's going on, help you work through it, so that you don't take it home in the evening. And if you do, as you might, then it's down to finding those strategies that we all employ to lower our senses and to keep us well and to maintain our own well-being. And we all find different strategies to cope with that. Rosie picked me because I mentioned before this session started that the way I manage my well-being and my mental health is I breed alpacas. Now, that might sound ridiculous. It's not just the animals, although I love the animals, but we all know, and I think if this pandemic has taught us anything, there's something about green open spaces that make us feel better. And for me, I would probably feel just as good, as we were saying before, with chickens in a green open space as I would with the alpacas. The alpacas, nevertheless, are fabulous, emotionally healing animals. And we did do, together with my alpaca colleagues, we did do a little bit of research around the benefits on our emotional health and well-being. But notwithstanding that, something about green open spaces and getting outdoors and washing away all that energy is really helpful for me. For other people, it will be something different.
Yeah, no, I couldn't agree more. I definitely think the importance of pets in general over the past year has been incredibly or it's just really been highlighted, hasn't it? I know my mum, who lives by herself, has her dog, and without her dog, she probably wouldn't get out of the house. So I'm just very grateful to the importance of pets. More dogs, I say. Okay, great.
Can I just chip in there for a
Oh,
minute?
yes, so please.
I don't want
do.
everyone to think that if you come into mental health, you'll become an alpaca breeder, because you could just as easily become an allotmenter, okay, which is what I do. But on a more serious note, a lot of the things that we're doing in mental health is that we're counselling people, we're giving them coping mechanisms, we're teaching them how to regulate themselves, we're giving them support and building supportive networks. We're asking them to be reflective and to look at how they can change their lives. And in doing so, we're going to pick up a lot of that, like through osmosis, as it were, you know, being surrounded by so many professionals working in this way, it's going to have a benefit on your mental health too. You will pick up tips. So yeah, it's not a clear cutoff of, yes, we're at work and we leave it off, because we're all evolving all the time and we're not on a clock on our evolution. It can happen at any time. It can happen just before you go to bed at 11 o'clock at night, you're processing the day's events and you think, well, maybe I could do that differently tomorrow. So on a serious note, working in mental health does give us lots of support with our own mental health and well-being.
Can I come on in that as well, Rosie? Do you have time?
Yeah, no, of course, go for it.
I've seen a lot of comments about people who sound understandably concerned about how it will affect their own mental health. And I just wanted to highlight one of the wonderful things about working in mental health is the amount of time we spend attending to that. You know, I myself had the psychoanalytic kind of psychotherapy during training. We have support groups within our teams. We always prioritize kind of team meetings. We usually have peer supervision, and you know, we work incredibly closely with each other to both understand our own reactions and make use of them. And actually, without them, we wouldn't be as effective as practitioners. And that's one source of information, is the way someone makes you feel in the room and kind of impacts on the relationship with you. So I can see Faye nodding, because it's a really fundamental thing in psychotherapy. And the other thing is that, you know, because we work so closely in teams and we know these things naturally affect us, we're very close to each other in our working lives. And I will pick up the phone to Anna Spiteri, for example, and at the end of a difficult day, and we'll have a bit of a debrief about what happened. And I think it's, you know, it's taken as read compared to some other professions where there are other professions which are quite traumatizing, actually, where there aren't these structures included to help support your own mental health. So I just thought I want to make sure you recognise that and that doesn't put you off.
That's a really great point. Thank you very much, Deborah. Okay, great. So we've got quite a few admissions-y questions, which we can probably answer quite quickly. So I've got one from Molly. Thank you, Molly, for sending one in. How long does it take to become a mental health nurse, and can you specialise in particular fields such as children or adults? If you'd like to answer that one. Anybody?
So
yeah, Reka?
3 years to become a mental health nurse, and you can specialise in any field you like, because once you're qualified as a mental health nurse, it's a generic qualification and you can work in any division of mental health.
Brilliant. Thank you very much. Okay, so I've got another one. How do I become a psychiatric nurse on a psych ward? Do I have to go to university, or can I go through becoming a HCA, then working my way up and doing my training on the job?
You can do both. So you could go straight into university, and there's a bursary, I think, of £500 a month at the moment that the government's offering, and that's for the 3-year BSc in nursing. Or you can be recruited. We've got 2 recruitment drives at the moment for people who've got no experience in healthcare, coming in to do a trainee healthcare program and then becoming trainee nursing associates, and that's all paid for. So it's an apprenticeship, so you'll get to work as a HCA and you'll come out of it after 2 years with a foundation degree, and then you can top up after that further 2 years for a BSc. So there's many, many routes into nursing: paid, unpaid, apprenticeship, or straight entry.
Brilliant, thank you very much. And if they want to find more information, I believe it's on the Step Into the NHS website, is that correct? Yep, so if you do want to find any more information about admissions or how to become a health practitioner, if you just Google Step Into the NHS, and that's the website, stepintothehs.com, and it's got everything.
And for BEH nursing inquiries, people that would like to come into nursing and want to be apprentices at BEH, you can always give them my contact and I can signpost for them.
Brilliant. Thank you. Thank you very much, Reka. Okay, so we've got another interesting one. What are the difficulties faced by being a psychologist during the COVID period? Or any mental health practitioner, I don't think just psychologist. Suchi, I haven't heard from you in a while. I don't know if you wouldn't mind taking the floor.
So there's quite a lot of psychological impact with COVID, as we know. Probably that's going to be the next pandemic, the psychological impact through COVID. So we are doing a lot in terms of psychology around the region, not just in Barnet, Enfield, Haringey, but across the whole patch, setting up well-being services for not just staff, but also the public. We are working quite a lot in terms of developing services for people who are suffering from COVID, acute COVID, as well as long COVID now. So just, in fact, this week, I was having a discussion with a UCLH respiratory consultant who's a clinical lead and running COVID clinics. In fact, she was on Radio 4 as well, looking at long COVID pathways and looking at the role of psychology in developing a model to support long COVID syndrome. But also, I think there's a lot around trauma. So some of the COVID sufferers are experiencing, and what we're trying to do is try and stem the development of post-traumatic stress disorder, because COVID is very traumatic in terms of losses, but also in the way that it's affecting the loss and the loneliness, so the social isolation. In fact, that's quite a paradox. Social isolation, the impact of social isolation, as well as intensely living under the same roof, doing online lessons, the children living together, and people trying to work, families trying to work. So what it has done, the paradox of some people experiencing social isolation, but on the other hand, the intensity of too much human contact has increased. As you must have heard, there's an increase in domestic violence and increase in conflict in supermarkets. So I think loss and injury can be a paradox as well. So I could go on about the impact, the psychological impact of COVID, but we are putting in a lot of resilience hub through what's called the North Central London funding for not just staff, but for public. There's lots of online support programs. There's lots of face-to-face, clinics that we are now putting in place. We're looking at helplines, so I could go on, but if you ask me something more specific, I can be more specific as well. Does that answer your question? Is it Molly?
It was Molly, yes. Yeah, I think so. If another question comes up, I'll let you know. We do have, unfortunately, we've got so many questions, we're not going to have time to answer them all.
That's fine.
Any admissions questions? One, if you're not specifically sure on what qualifications you need, those kind of questions. If you go to the Step Into NHS website, it will tell you very, very clearly exactly what you need to get into your chosen profession. So I'm very sorry that we can't get through all of them, but thank you so much for asking all these questions, everyone that's listening. So I'm going to pick a couple more. There's quite a few questions about virtual work experience. So do you guys know, one of the questions is, can you do work experience in mental health at the moment? And what courses do you have to take to get into university for a mental health course? So it's kind of asking two different questions. So in terms of work experience, what would you recommend? Is there any virtual opportunities out there? I don't know if anyone can answer that one.
So one of those hats that I wear come in useful now because I'm from the nurse education team.
Fantastic.
So, and I work very closely with learning and development. So I think all of the future work experience that we'll be coordinating. So it's really interesting because our Deputy Director of Nursing has asked us to look into opportunities for having work experience. Now, due to lots of legal complexities, and if you're under 18, it's always been very difficult to do this. But virtually, I think we can open up some learning opportunities for you. So it might not be inpatient or patient contact, but what we could do is certainly look at terms of how we invite you to look at, say, the nurse education team and how we work with student nurses and apprentices. So if you're interested in that, Rosie, just drop me a line and I'll organise something.
That's great, thank you. And in terms of, because we have a lot of students asking us, you know, obviously they've not been able to do practical work experience, or even just getting a, you know, taste of what it's like to work in certain organisations. Are there any virtual opportunities that you know of, or can you recommend people who are applying to these courses? Is there anything that they can do now to improve their chances of getting into a university course? Yep, Deborah?
Yes, I mean, as well as the traditional kind of volunteering for work experience, there's also those kind of any carer roles that you can get involved in. So whether it be being one of those volunteers who takes meals to people who are isolating, or older people in a care home, or, you know, I think anything that increases your contact person to person with, particularly with vulnerable people. I mean, if I was looking at someone who'd gone to work in a food bank, for example, I'd be looking pretty favorably on that, because you have to work as a team, you have to be able to have people skills. I think anything that develops those kind of skills is useful.
Yeah, no, I think that's a really good answer. Thank you.
And also in terms
we've got
of
a poll just popped up.
Oh, sorry. Just for interviews and for getting into the course, I think, as well as work experience and your university grades, I think research the area that you're wanting to go into. I think that's, a third of my job is recruitment. And I think one thing that really stands out on our exceptional candidates is the fact that they've researched the roles that they want to go into. They're very much aware about the breadth and the scope of the practice area, and that will really shine through an interview. So that will really help you.
That's a great tip. Thank you very much, Reka. We have just launched a poll. I can't believe it's already, we've only got 2 minutes left, but please do give us feedback on if you found this session useful, and do vote on that poll. Hopefully you can see it has just popped up. We've got time for maybe one more question. I've got one that's one of my favorites. So it is, was there anything you'd wish you'd known about being a healthcare practitioner before starting your career? And this is the last question that we can ask. Anna, I'm not sure if, I haven't heard from you in a while, if you want to finish the session with an answer to that one. Is there anything you'd wish you'd known? It's a big one.
Yeah, very good question. Well, certainly my role as a physiotherapist gave me a great amount of flexibility to work part-time when I was bringing up my family. So I've got 3 children, and when they were young, I was able to work part-time, and I really, really appreciated that. And then to come back to the workforce full-time, you know, when the children are a little bit older, was really useful. So for me, that was important. Perhaps, you know, on reflection, perhaps I would have come back into the full-time workforce a little bit quicker than I did. I did take a number of years out working part-time, and I think on reflection, I perhaps wouldn't have done that. I would have come back a bit quicker. So I'm trying to do a bit of catch up now. So yeah,
that's fair enough. That's great. Thank you. Well, everyone, we've still got so many questions to get through. Unfortunately, we can't get through them all, but it just goes to show that these guys are so interested in what you're doing, and we've already had a few people saying thank you very much for your informative answers. If you do have any specific questions about, like I said, the admissions, or if you want to find out more, do go to that website that I've mentioned, Step into the NHS. I have loads of information there. But for now, I'm really sorry we're going to have to go. We've got another session starting in 5 minutes. Thank you very much. Thank you, Anna. Thank you, Deborah. Thank you, Reka, Suchi, Faye, and Tanya, so much for all of your amazing answers, and I wish you all the best, and thank you for supporting our students. Have a great evening. Thank you, everyone.
Thank you. Best of luck to you all. Bye bye.
Thanks. Bye.